My name is Catherine Madden, and I'm really pleased to have you here tonight. We've got a couple of great speakers as well as a patient speaker who's going to share her story, and our goal here is to have you leave feeling motivated, encouraged, educated, and informed. So I'm just going to talk to you a little bit about Kidney Cancer Canada initially. I'm just trying to get the slides to go. There we go. So who are we? We were founded in 2006 by two patients who met in a waiting room at Princess Margaret Hospital in Toronto. They knew that they needed more support and more services, so they took it upon themselves and gathered a band of folks together and created the first and only Canadian charitable patient-led support and advocacy organization focused exclusively on kidney cancer, and we continue to be that single organization. We have a growing patient and caregiver community, as you can see from our map across the country. Those represent patients and caregivers who've put themselves on our map. So from those two people in 2006, we now number over 2,100 people within our community and engaging in interaction and sharing of information. Our mission is very simply to improve the lives of those affected by kidney cancer across the country. We do that by providing support, information, and education, by raising awareness of kidney cancer as a significant health issue, raising funds for research, and advocating for patients in terms of access to treatment and clinical trials. Behind the scenes, that's a picture of our board of directors. They're all volunteers. We are very lean and focused. We have one full-time staff member, that would be me, and we have two part-time administrative support people. One is Mona, who you would have met at registration, who helps us in French language out of the province of Quebec, and Michelle Sadeko, who is our part-time admin in Ontario, dealing with English language and creating the information that goes out for patients. We have a working board of directors, as I said, but they are all volunteers, they are patients, they are caregivers, and they are professionals. So they've walked the journey in many cases, and they understand what patients and caregivers are going through. We estimate that over 38,000 hours were put in by 80 volunteers within 2012. So we are extremely volunteer-based, by patients, for patients, working on behalf of people across the country living with kidney cancer. And we are virtual. We work from home offices. We use other people's space whenever we can for meetings and try and keep things lean. We are considered and consider ourselves to be highly respected and credible. We have a medical advisory board of 19 of the best and brightest in RCC across the country. We have our Kidney Cancer Nurses Network, which is an opportunity for nurses seeing patients with kidney cancer across the country to connect with one another, use each other as resources. We share information with them, and they can have online dialogue where they're dealing with treatment side effects and things like that. So again, to create a community for the nurses. And then we have the Kidney Cancer Research Network, of which we are funders and collaborators, and they're looking at really important things beyond just sort of bench research. They're looking at quality of life for patients, they're looking at genetics, they're looking at survivorship, and they're looking at personalized medicine. So their work is very important, and we continue to support them. Our shared objectives are access to all approved treatments. So we want to be sure that you have access to treatment regardless of your province, regardless of your age, regardless of your coverage for insurance status. We want to increase awareness of those treatment options and ensure that both patients and physicians are aware of those options. We want consistent and high quality standards of care throughout Canada for patients. We want improved quality of life through support and dissemination of information. That's keenly important with living with kidney cancer. And we want to ensure that there is continued increased funding for kidney cancer research. We provide a lot of evenings such as this, patient education and support. We try and have 6 to 8 of these meetings across the country over the year, including our National Patient Conference. And for patients, caregivers, and others, those family members and friends who are looking for information and ways to support you folks, we provide that information through a website available in both French and English, where there's a wealth of information, and we also have that interactive map that you saw at the beginning, and also our discussion forum. So again, another chance for you to create a community and connect with other people going through this kidney cancer journey. We offer peer support both online and telephone. And again, we have the patient meetings, and then we will have our National Patient Conference on March 29th in Toronto, in 2014. This year we were in Vancouver, had 160 people out, and had a great day, a wealth of information from many of the experts in kidney cancer. Our website, if you haven't been there yet, I talked about the fact we have a discussion forum. It's a place you can go online. There's a variety of topics and information. You can ask questions through the discussion forum and reach out to others interactively through email. We have our interactive map, which again is another way to connect with people. We have educational videos and information about the clinical trials that are going on across the country, as well as the treatment options by province in terms of access to those treatment options. We have questions to ask your doctor to help you through that journey, and top 10 tips for survivorship. So if you haven't had a chance to get into the website and really poke around, I encourage you to do so. There's a wealth of information for both patients, caregivers, and all of those who support you. We have a variety of publications that you've seen here tonight as well. A newsletter, our information brochures. We have posters that go up in the cancer centers and community oncology centers to let patients know that we're here and to try and reach out to provide support to you. And for more information, as I said, please visit the website, register with us online. There's no cost, and we are available in both French and English. Be sure to leave us your contact information if you haven't before you leave today, and follow us. We're on Twitter, we're on Facebook, we're on YouTube with videos from several of the meetings such as this, and we have a WordPress blog where we're talking about timely issues in terms of kidney cancer treatment and other related issues.